Staffing shortages have led to gaps in coverage in the province's sexual assault nurse examiner program. Assembly of Manitoba Chiefs Grand Chief Kathy Merrick is concerned it could put survivors at risk of re-victimization.
It could also discourage our women from going there if they're hearing that these services are not provided in an adequate way.
The program, known as SANE, has relied on 13 casual nurses to conduct forensic examinations on survivors, but 7 of them quit this week. Health Sciences Centre's head of acute health services, Jennifer Cumsty, couldn't say how many hours per week the program will be without staff, but she says there is a backup plan.
Effective today, we have a group of physicians and some nurse practitioners that have come forward and are willing to cover those gaps so that we will be able to continue to provide care for survivors.
Cumsty says there have previously been gaps in coverage when casual nurses couldn't pick up shifts. Last April, the provincial government announced money for permanent positions to expand the program. 6 of 7 of the new jobs, which are part-time, have been filled, but only one of those nurses who came from the casual pool is currently trained. The remaining 5 still need more education.
We're putting in place today the process if there is not a trained nurse on duty, what the steps will be to activate the backup plan.
I find this to be unacceptable.
Health Minister Audrey Gordon previously blamed shared health management. At a separate announcement Thursday, she said there's still work to do to get the program fully up and running.
To meet the needs of individuals who experience this horrible trauma, that is our government's commitment, and that is when I will be satisfied.
The program's been unable so far to deliver on plans to offer 24/7 coverage. Merrick worries it could deny victims access not only to health care, but also justice.
And it's something that the province should have to work to ensure that the nurses are there to be able to provide that service to our people.
Health leaders want to talk with the 7 nurses who resigned to better understand their reasons for leaving and to see if they'll consider coming back. Josh Crabb, CBC News, Winnipeg.